Okay, thank you, Claudia. So the first of course is thank you, Claudia and Danny, for the invitation. It's really a pleasure to be here in this institute. So I know that I knew before coming that the institute was a reference in research in Spain and in Europe, I would say. But after looking at and visiting the facilities, I have to say to the young people that are here that maybe you don't know, but you should be very proud of belonging to this institute. And when you travel around, especially Spain and also Europe, you can see that most of the institutes are well below this in terms of facilities and research activity. So you are very lucky. So be proud of that, and that's what I have to say. Just to congratulate you for what you are doing here in the institute. It's really amazing. So as Claudia said, I'm coming from the Universidad Autónoma de Madrid, and then usually I have a slide to introduce what is the Universidad Autónoma de Madrid for English, for people not from Spain. I just put the map of Europe, Spain, and Madrid, just to introduce. It's not necessary here, but I want just to put a picture of our campus that is a very similar campus to this. So we have all faculties surrounded by different research institutes from nanotechnology, biology, and I also say the people that Madrid is super beautiful and blah blah blah. And I keep the slide because I know that there are people here that is very strange. So I always start my slide putting the Real Madrid teams and the Real Madrid picture, because when you travel abroad, it's not, I mean, sometimes it's the pressure, but what the people knows more about Spain is Barcelona, Barça, and Madrid, okay? So I put Madrid. I am not supporter of Madrid at all, but I put this because then the people recognize where I am. And I will say that there is another team in Madrid that is also doing well, that is NanoBig, that is the group that we have in Madrid that was created like 15 or 16 years ago. We start to develop nanomaterials for just fluorescent dynamics at a nanoscale, and then we just make the evolution during the different years. We jump from cells to animals in more than 10 years ago. Then we start also single particle studies for biosensing. And now we are starting the research line or applying artificial intelligence to improve all our previous results. So the main idea of our group at the beginning was to try to use light to do bioimaging in preclinical research. So we were trying to do real 3D imaging and 3D sensing by using light instead of X-ray or MRI. So the basic idea is that we are going to use nanoparticles, mainly functionalized nanoparticles, to target some kind of organs or tissues, and then trying to localize that by using light that so it has several advantages in respect to other techniques. So this is the main topic of the group. Okay, so this is the main target, and there are two people working in different lines. So the group now is has evolved. So now we are quite too big group. Let's say we have like 5 seniors and 19 PhD students working on different subjects, and this is what we are doing. Mainly the group is divided in two. From one, there are people using single particle spectroscopy by optical tweezers and single particle manipulation to do biosensing in cell, plasmonic structures, bacteria, and so on. And there is other people that is working on the development of luminescent nanoparticles for in vivo applications, for real in vivo applications. We have a laboratory in the School of Medicine for in vivo and a laboratory in the Faculty of Science for the other materials. These are the different students that are taking care of the different projects now in the group. And In particular, we are working on NIR-II biological window. The NIR-II biological window is the wavelength between 1 micron and 1.4 microns, and we are interested in those wavelengths because the tissues are partially transparent in this spectral range. So it means that the light in this area is able to propagate. In fact, it's the typical example. You put your finger in front of a light, you can see your bone in red because the red light is propagating through the tissues. When you look at the biological tissues and you calculate how is the penetration light of NIR-II, you can see that the theory says that you can see up to 1 centimeter under the skin with this light. I will show you later that this is not true, that this is an underestimation, and that there are different nice works that are just multiplying this by orders of magnitude. So this is the idea, to use nanoparticles that has emission between 1 and 1.5 microns, try to see if we can penetrate well into the tissues, okay? And then this is we work on different materials, but our best material, our Ferrari, is the silver sulfide nanoparticles. These are very small nanoparticles, 8 nanometers in diameter. They have you can grow very homogeneous one, and they have a very nice absorbed emission at 1.2 microns, just in the middle of the biological window. So if these nanoparticles are within the body, then the light that they are going to generate is going to propagate through the tissues without attenuation and minimum scattering, and you will see very good optical or fluorescent image. And then, in order to combine you, I will want to show you this result. I don't know if we can switch off the light a little bit because it's a video. This is a fluorescent video. We have, I want to explain from the beginning. We have a mice that is under anesthesia. Here is the tail of the mice. We have here our silver sulfide nanoparticles, and we inject the nanoparticles. These nanoparticles were coated, so they were not attached to the liver or to the spleen, so they are going to keep in the cardiovascular system. Then we illuminate the mice with a 800 nanometers laser, so it's cheap laser, and then we record the luminescence at 1.2. And here, well, I don't know if you can see, the quality is, I don't know why, I can see well in my screen. Okay, so this is here, this is the heart that is beeping, this is the liver, and this is all the cardiovascular system that you can see very clearly. It's like the animal becomes transparent, okay? So really, you can see that you can really see a very nice image without tissues, okay? So this is real time. The acquisition time is 300 milliseconds for each frame, so they are quite bright. And with this kind of technology, you can really see inside. It's more than 1 centimeter, and I will explain you later why the actual penetration depth is larger. If you look in detail, you can do high resolution imaging of the arteries and so on. One of the beautiful things of the silver sulfide is that they have a very broad emission band. So when the nanoparticles are in subcutaneous injected, then you have the very nice emission spectra. When you take out the organs that are accumulated the silver sulfide nanoparticles, you recover the spectra. But when you take the spectra, when the nanoparticles are inside the animal, you will see that you can see that the spectra is distorted. I will explain you why and how we can use this to get molecular image. Okay, this is very clear to explain, and we will explain later. So we have different research lines, But one of the research lines is that to use these nanoparticles for cardiovascular research. Okay, we want to use them for cardiovascular research. Okay, if you look at the numbers, okay, unfortunately, Claudio, okay, so the idea is to improve the life expectation of patients with myocardial infarction, and we can see that in the countries that they have record the statistics, there are more than 16 million people per year having an infarct, and 20% of them are fatal consequence. It means that, in other words, it means that 3 million people are dying every year because of myocardial infarction. Okay, why is that? The problem of the myocardial infarction is you have the arteries that are supplying oxygen to your heart, to the myocardium, that is the muscle of the heart, and then you have an accumulation of lipids or calcium or whatever that are blocking the blood perfusion, and then you stop providing oxygen to the heart. At the end, you damage the heart, and then the heart can stop working. So this, you have the cause, the origin of that is the plague, and you have the consequence that is that you damage your heart. So we were working on both of them, okay? For instance, we try to use our silver sulfide nanoparticles to target or to localize the damaged tissue in the heart. So we have the silver sulfide nanoparticles. We decorate with receptors of the AT1. That is when you have an infarction or a heart attack, you have an overexpression of this marker. So we coated our silver sulfide with this to attach or to bind to this overexpression molecule, and then we induce an infarct in a mouse, and we inject the nanoparticles. And this is what we have. And then let's suppose that we inject the nanoparticles in a healthy mouse. You can see that nanoparticles are accumulated in the liver and the spleen. Then you have a mouse with a heart attack. After heart attack, you introduce the non-functionalized nanoparticles, so they are not attached or they are not local, and they are not attached, to the damaged tissues, and then you have still, you have again some kind of liver and spleen accumulation. But when you do in an animal with a heart attack, then the damage of the tissue that is in the heart can accumulate, or all the nanoparticles are accumulated where the damage has been induced in the animal. So this is a very fast way. You take 1 minute to take the image. You need 1 minute after injection to take an image. It's a very fast way of localizing where is the damage of the tissue and how large is the tissue that you have damaged. How important is that? Okay, so this is the work that we did, trying to localize where is the damage. But can we use the same technology to treat or to study the cause or the origin of the infarct? Okay, the idea is yes. How usually, if you have an infarct, how usually the doctors treat you, or how the doctors try to remove that problem? Okay, so in 1929, there is one doctor who demonstrated that it's possible to use a catheter and to reach the different arteries inside the heart. So the funny story of this doctor that was Nobel Prize, Werner Forssmann, is that he was convinced that he was able to put a catheter from his arm to the heart, to the coronary arteries. He applied for different permissions to the hospitals, and the people in the hospital say that you have no permission to do that. So his decision was to do by himself on his own body at his office. So he took a catheter from typically used from the urinary system. He took a catheter, he went to his office, he introduced the catheter in his arm, and he just reached the arteries. He went with the catheter to the X-ray department of the hospital and said, "Can you take me a picture of that? I want to demonstrate that I can reach the catheter, I can reach the heart." This is the actual image of the first one, did by himself. Okay, so it was funny because if you read the book, they explain how they did that, and he got the image, and the day after he was fired from the hospital. Okay, but he doesn't care because he just got the Nobel Prize of that. So thanks to this doctor, you can develop this technology that is the stent technology. That the stent technology is that you have an implant that is a metallic implant now. It was polymeric in the first years. So you can put the catheter, you can introduce the implant, you inflate a balloon externally, you open the artery, you de-inflate the balloon, you remove it, and then you can just go away, and then you repair your artery. The first implant was in 1986. It was the first time that the stent was implanted in a human. It was in 1986 in Toulouse, France. And after that, the statistics say that 4 million implantation per year worldwide, except without counting China, okay, because China is not in these statistics. 4 million implantation per year. So if you think about how many lives this technology has saved during the history, it's around 50 million people. So it's not Spain. Okay, so the implants are super nice. They are somehow cheap. Okay, and the mortality during implantation is only 1-2%. It's very low. You avoid invasive surgery, so you don't need to open the patient, minimize the infection risk, and you have an ultra short recovery time. So in principle, after the implantation, just seconds after implantation, you are safe and you are as healthy as before. Okay, if you want I want to combine you, I will show you this video. This is myself after having 3 implants and 2 infarcts, just running 2 weeks after the implantation. So really, you will recover super fast. Okay. Okay, so this is nice technology. You have the implant in your artery, and then you go home. You just have to take some medicines to avoid accumulation of plaquettes on the implant and so on. And then you can almost forget about your implant. Okay? But this is not true. It's not true. You look at the statistics, almost 80% of the implants after 12 years after implantation, they present severe problems. Okay? So it's not like you have the implant and then you are safe. So you have to take care about what you are doing with the implant. You need to take care about that. There are different complications about these implants, but the most important thing is this one, that is what we call restenosis. Restenosis is you have the implant, you open the artery, but the lipids or the calcium or whatever is accumulating on the artery is still concentrating there. So then what happens is you have the implant and you solve the problems for years, but the lipids is still growing, and then you block the artery again, and this has no solution. When you have that problem, the only solution is surgery. You cannot put a second implant, okay? Of course, you can try to, and then the problem is not that there is no solution, is that when you recognize that you have this problem, you're kaput, okay? So how the people is trying to they did an analysis or diagnostic of this. So there are different technologies. The main technology is ultrasound. They introduce a catheter with ultrasound, and they take a cross view of the artery and the stent. And here you can see here that this is the stent, okay, and you can see here that this anomaly that the doctor said, okay, this is lipids. We have more lipids there, but you can see that the spatial resolution is very low. The other possibility is to do X-ray, okay, and try to see how the stent is if it is deformated or not. But the X-ray is giving you a very, very low contrast. This is my artery, and I have one of my stents here, and the stent is from here to here, but it's very difficult to see. So really to do the diagnosis, the only thing that they can do is try to check with the balloon that the emitter is okay, but it's difficult to do a diagnosis, okay? So what we are trying to do is trying to combine these stents with luminescent nanoparticles and artificial intelligence to make the stents able to do a diagnosis. Not only to solve your problem, but to give you information about your artery. And how we are going to do that? This is the main objective of the project, is that you have the stent, a commercial stent, okay, so you have to contact the companies, I will tell you later. You have the stent, you need to combine with different luminescent nanoparticles, and then these luminescent nanoparticles are going to be excited, and from the emission or the lifetime of the luminescent nanoparticles, by using artificial intelligence, in particular neural networks, you are able to deconvolute the noise and do analysis to get information about the calcium, lipids, or temperature, okay? So this is the final idea. I want to convert or to transform a normal implant that is not active, it's only to open the artery, into a really active implant that is able to give you information about how your artery is, okay? So this is what we are doing. We contact the company Abbott. Abbott is a pharmaceutical company that is one of the main manufacturers of implants, okay? And then we just ask them to have permission and information and to have some samples, real samples of Abbott implants, in which we were going to do different coatings, polymeric coatings, with and without nanoparticles, okay? So we have the implant, and we start to cover the implants with a polymer, then with nanoparticles, third polymer to make the implant still flexible and luminescent at the same time. This is a cross view of the filament of the implant, in which you can see the different layers that we were able to produce on the implant, on the commercial implant, okay? So then, what we did, this is an optical image of an implant, of a stent, and this is the fluorescent image of the implant after our treatment. So we just managed to attach the nanoparticles to the stent, so the stent becomes transparent, luminescent. And we can see that we can excite at 800 nanometers, and we can collect the emission at 1.2, that is in the middle of the second biological window. The stents are super homogeneous. The homogeneity is better than 3%. We perform experiments in animal models to test the toxicity of the stents and how long the stents are keeping the nanoparticles. Up to now, we have monitored the stent stability during 8 months, and the stent works nicely still. So we have a system that is simulating a blood perfusion, and then we are evaluating every month if the stent is giving us the same signal and the flexibility. So it seems that it's working well. The toxicity experiments are giving us some good results. I mean, they are not toxic. So it seems that they're working. Then we just jump into the animal experiments and we start with rabbits. So this is the artery of a rabbit that after arteriosclerotic rabbit. So this rabbit was subjected to a very fatty diet. So it has a lot of plaques and bad arteries. The arteries are not very good. And then here, this is a fluorescent image. Here you have the artery, and we introduce our catheter with our stent, okay? And this we illuminate with the laser and we collect the image. And then we perform the implantation, okay? So this is implantation. You can see we inflate the balloon and we open the artery in real time, and we were able to see how the expansion of the stent has been produced, and the doctors are able to see that it's something that they are not able to see now with X-ray. If the implant is homogeneous, if the implant has been well attached to the surface of the arteries, and they're able to do in real time, okay? So this is a great advance. Then we just take out the arteries, and this is what we obtain. This is the artery after the implantation. Here is the optical image. You cannot see nothing. When you illuminate the artery, you can see clearly that the stent has been well implanted, and in fact, it's very difficult to remove from the artery. It's a very good news. So it seems that the stents are working, okay? And you can see in real time. But not only that, and this is the most beautiful part in my opinion. This is the artery with another stent, and then this is OCT, optical coherence tomography. That is a technique that cardiologists are doing now every day to see the cross-section of the artery during implantation. So here you have the artery of the rabbit. Here is closed. Then we implant the stent, it's open and it's closed again. But here you have something strange that the doctors, they identify as a plaque or extra lipids that has been allocated inside the stent. Okay, so you get the fluorescent image, you don't see anything. You just see the signal coming from the stent. But what happens if you look at the cross-section of the OCT cross-section? This is the part A, where the artery has been well opened by the stent, but when you go to part B, you can see that the stent is not working well in some parts of the artery, and there is some like extra material there that the doctor said that probably there are lipids that are allocated inside the stent. So, okay, that's very difficult to see from fluorescence, but what happens if you compare the emission spectra? This is the emission spectra of the stent that you can obtain with a hyperspectral imaging system in vivo. You can do that in vivo, and you can get the image or the spectra in position A and position B, A and B. And you can see that you have, in general, the broadband emission of the nanoparticles, but look at this. In B, where the doctor says that they think that there is a lipid deposit, the spectra has been modified, okay? And then, why is that? The explanation for that is that exactly in this spectral range is where the lipids absorb. And then when you look at the literature, where are the lipids absorbing light? They absorb at 1.2 microns. That is where our stents work. So what happens is in those areas or those locations in which you have lipids, they absorb the emission of the silver sulfide nanoparticles and they distort the spectra, okay? So the idea is very simple. You have the emission of silver sulfide, then you modulate by the presence of lipids, and then you obtain the distorted spectra. Different lipids, they have different shapes, okay? So the idea is the following then, okay, so then this change in the emission spectra is due to lipids. If you calculate the ratio between this and this, then it will go, this ratio will change if we have lipids. So this is what we did. We have the emission spectra. For each position, we can calculate the ratio between these two bands, and then this map gives you where the lipids are. If the ratio is the same, there are no lipids. If the ratio changes, you have lipids. So we were able to localize where the lipids are in the artery by looking at the emission spectra. Okay. But I showed you this image in which you said that I showed you that the different lipids, the different types of lipids, give you different absorption spectra. Okay? From the cholesterol lipids, they have this peak here that is dominant, but phospholipids, they have the spectral dominant in the other peak. This is because you have different CH groups depending on the lipids. And this is very interesting because when you have this ratio between these two absorption and these two absorption peaks, gives you a ratio or parameter that is R that varies, change from 1.3 to 0.6, okay? When you have 1.3, it means that the lipids are triglycerides. When you have 0.6, you have cholesterol. But what the funny thing is that this is related to the type of plaque you have in your artery. When you have a plaque that is fatty streak plaque, then that is when the plaque is starting to develop, when the plaque is starting to grow, then you have the most dominant lipids are triglycerides. And then the spectra is this one, okay? But when the plaque is almost close to break, I mean almost very big plaque, then you have this necrotic core plate that is at the final stage of the plate that is super dangerous to be here. Then you have a plate that is full of free cholesterol. And then the absorption spectral lipids are different. So then this parameter is an indicator of which kind of plate you have. So, okay, this is our spectra. And then we can try to see from the change that you observe in the spectra, you can try to see which kind of lipids you have in your artery. Okay, so we just divide one signal by the other, and we can have this kind of a spectra, and then we compare by artificial intelligence, and then we can find which is the best type of lipids that fits this extinction spectra. In this case, the system tells us that this cholesterol lineage. So it means that in our particular animal model, we are here at this stage of the plaque development. So we are here, we are close to be a vulnerable necrotic plaque. That is something that is really in agreement with the observation from the observation from the medical. So the idea, the final idea of this project, okay, let's try to do the implant. Let's try to put a transmitter for the people who has an implant, a transmitter, excite the stent, recover the signal, and send your information to a mobile phone, okay, to a smartphone. Okay, this is something that is not going to do nobody. And this is real. Okay, this is a video. This is a company that is already working. They have this kind of emitter and receptor, and they put a microplastic that is fluorescent under the skin, and they excite, recover the luminescence, get the luminescence, analyze the luminescence, and send the information to your smartphone. This is the Profusa company, and from that, the video stopped here, but from that, if you look at the web page, they have developed these materials for pH, glucose, temperature, and tension, blood tension. So the technology is already there. The thing, if you look at this, they work in the visible. That's why they work up to 1-2 millimeters. With this new technology, you can do implants that can be working up to, I will say you, centimeters. Okay. Okay. So now you are wondering, okay, Danny, but this is we are not transparent. The light is not propagating through us. So maybe you can reach 1 centimeter. 2. But what happens is I am very big. Okay. And then I have an implant here, a coronary implant. There are like 5 centimeters between my sensor and the implant. So no light is coming, right? Okay, this is not true, first, because you only need 1 photon to get the signal. So you, with single photon detectors and the artificial intelligence, you don't need too many photons to do the sensing. But there is another technology that is breaking the market. This technology was developed in Stanford. It was a paper published 2 years ago already, and they were doing transparent tissues. Okay, so they have the tissues, and they just use tartazine, that is a dye, a commercial dye, used for Doritos, for instance. In the Doritos, they use this dye. Then they fabricate a cream, and they apply the cream to your skin, and your skin becomes transparent. Why is that? Because there is a resonance in the refractive index that match the refractive index of the scattering units to the refractive index of water. I mean, it's a long history, but what happens is that you are able to reduce the scattering by applying the cream. Okay? So that's a very nice thing. And if you look at the different papers already published, this is the typical picture of a mice, okay, before applying the cream. Then you apply the cream, and you can see the mice as a transparent, okay? Amazing, okay? Really, I mean, the cream is very easy to prepare, super cheap, and you need to have a very strong personality, to avoid applying to yourself, okay? But when the students were working with them, sometimes they just put some of that on your skin, and it's amazing. I mean, you don't feel very well. It's like, okay, I don't want to do that, but you become transparent, okay? So there are videos. You look at this paper, there are videos of pregnant mice in which you can see the different babies there, okay? And you can see how the mice is working, and they have a camera from the bottom, and they can see the muscle, everything. Amazing, okay? So very, very nice. So what we did, we put our stent under 5 centimeter tissue, okay? And we try to see if we are able to see the stent under 5 centimeters. 5 centimeters is something that is really something that is good number, okay? So then we have almost nothing, no signal from our implant, okay? Then we apply the Doritos cream, okay? We apply the tartazine, and this is what we have. The tissue becomes transparent. So in my feeling, this is a revolution in the field. And if you look at the literature, I mean, in the next MRS symposium, there is 1 or 2 symposiums only about the possible application of this technology for everything, for the brain, for everything. So it's really, really amazing. It's reversible, and okay. Okay, so I want just to finish saying that we can do more things about that. I mean, no, we cannot. Let's forget about stents, and let's try to see if we can take more advantage about the spectral distortions. Okay, so this is again, there is the distortion. Lipids are not the only thing that is distorting the spectra of the silver sulfide. Water is also another element that is distorting. This is absorption of water, and you can see that overlaps with the emission of silver sulfide. Tissues are full of water. So if you have a nanoparticle under a tissue, because of the water of the tissue, you make a distortion in the emission spectra. How large is the distortion? Depending on the thickness of the tissue. If the tissue is super thick, the distortion is going to be super large. If the tissue is very, very, very thin, the distortion is going to be super weak. So if you are able to measure the distortion in the emission spectra, you can identify or you can calculate which is the depth of the silver sulfide nanoparticle. So you can do 3D fluorescent imaging or 3D tomography, of fluorescence tomography. So this is what we have. When we have no tissue, that you have the emission spectra of the silver sulfide. As you put more and more tissue between your emission the silver sulfide and your detector, you have more and more distortion. And then depending on how much tissue you have, you can do or you can calculate which is the thickness. But the good thing is that silver sulfide also depends on temperature. So the spectra of the spectra that you collect from a silver sulfide nanoparticle depends on which is the temperature of the silver sulfide nanoparticle and how deep is the silver sulfide nanoparticle within the animal. So what you can do 3D thermal tomography. That's something that is difficult because it's easy to measure the temperature of the skin, thermal camera or whatever, or just a thermometer. It's also easy to see the temperature of the liver. You put a thermometer inside. But what is not easy to do is a 3D thermal image inside the tissue. So in principle, we can do that, okay? We can just take the emission spectra of silver sulfide inside the animal, and we can calculate which is the temperature and the sensitivity. But it's not so easy because there's cross sensitivity. Because you have an spectra, you don't know if the spectra is distorted because you change the temperature or you change the thickness. And here is where artificial intelligence jumps into the project. So what we did is we trained the system taking thousands of spectra at different temperatures, thousands of spectra at different thickness, and thousands of spectra under different tissue characteristics. We take tissues from pig, from chicken, from as many as you can find in the supermarket, and we put the different tissues, and we measure thousands of spectra at different temperatures, thousands of spectra at different thickness, and we just put all this data into a unit, okay, so into a convolutional network, okay, so a neural network. So we just put all these spectra into the neural network, and then after training the system, for each spectra, the system is able to tell you which is the temperature and the thickness or the depth within the tissue. So you just need to give the spectra and give you two data, temperature and thickness. Okay, so just we jump into in vivo. Okay, so we perform a very simple experiment. We just have a mouse, and we inject the silver sulfide nanoparticles, and we focus our NIR camera in a very, very, very small area of the animal. Okay. This is because we need to do hyperspectral imaging, and if you try to do a very big area, it is super time consuming in our system. So you need to go to a small area, so that's why we prove this system here. So then we have this emission spectra, fluorescent spectra, that don't tell you anything. just that the nanoparticles are flowing through the different arteries and small veins. You can see here, okay? But you don't know if this is more deep than this. You don't know anything, okay? So you just take the emission spectra per pixel, you apply the neural network that you have trained before, and this is what you obtain. This is temperature. I don't know what is this temperature. This is the image of the artery and the temperature of the blood. Okay, so the nanoparticles are within the blood, circulating in the animal, and this gives you a 3D thermal image of the artery, and the colors indicate you the temperature. White means lower temperature. Red means higher temperature. Okay, I don't know what is this, but it's funny because the blood that is closer to the surface, that is a lower depth, okay, so 0 millimeters, is cooler than the blood that is inside. Okay, of course, because when you have the blood is close to your skin, the skin is cooling the blood, and this is what we expected. So what we were is we just summarize all the experimental data from this 3D thermal image, and this is what we obtained. This is the temperature versus the temperature of the blood in the artery or the veins as a function of the distance to the skin. When you are very close to the skin, you have like 35 degrees, okay? And when the blood is like 5 millimeters from the skin, then you recover the 37 degrees. So it's exactly what we were expecting. So this is the first demonstration that we can do 3D thermal image in a live animal. Okay, and this was done by using the artificial intelligence and the training to the system. Okay, so I am going to close to finish. Sorry, and I want to say you that it seems that every time that you put a nanoparticle in the animal, the spectra of the nanoparticle changes, and this is super nice because thinking about how the spectra change, you can get information about the depth, the presence of lipids, calcium. So we are working on different markers that we can do just looking at how the spectra change. But be careful, be careful, because in some cases the spectra change, but this is not because of the interaction with the tissues. Okay, so we were working a long time with gold nanoclusters. Gold nanoclusters, I don't know if you have worked with them, are a cluster of 25 gold atoms surrounded by different ligands, and they are wonderful. They are super bright, hyper mega super bright. Okay, in the NIR-II, 1.1, 1.2, and then when you inject into the animal, you can get this kind of fluorescent image that are amazing. You see, so it's super high resolution, very low acquisition time. You can see all the vasculature of the animal in 10 milliseconds. 10 milliseconds, nothing. And then we start to, okay, let's try to see if we can use that for sensing. Okay, and then we start to do the hyperspectral image. And then this is what we obtain. This is the emission spectra in the solution, the original emission spectra. Okay, a very nice brown band around 1.2, like silver sulfide. And then when we took the spectra in the blood in real time, this is with the hyperspectral imaging system, the emission spectra has nothing to do. So we spent like 1 year and a half trying to do imaging with that and trying to say, okay, wow, this is amazing. A nature scan, you know. So because this is because we can sense proteins and we can sense many things because absorption of the proteins is modifying our spectra. Half a year making stupid things. Okay, so after some time, we discovered that it's not because the gold nanoclusters, the emission spectral glow nanocluster is absorbed by the tissues. This is that the glow nanocluster are completely destroyed when they are interacting with proteins. So what happens is that you have the glow nanocluster, and then we check when we realized when we were doing the supporting information of the paper, and okay, let's put an image of the cells. Okay. And then we measure the spectra in the cell, and was the same as in vivo. So it's not the tissue. It's when the gold nanoparticles are inside the cell, the different environments, change of the environment is changing completely your emission spectrum lifetime. So all these things are not due to spectral distortions, are because your probe is completely changed when it interacts with proteins and with cells. So this is something that the people usually don't look at, how the emission properties of the different probes change when they incorporate in the animal. And this is because it's very difficult to do hyperspectral imaging in a live animal. So taking the spectra is very difficult, but I can anticipate you. You take the reference materials used for bioimaging, like quantum dots or infrared emitting dyes. If you look at the spectra, for sure, you will get some surprises, okay? So this is my final conclusion, and I put my talk to the ChatGPT. I said, can you draw something for me about the conclusion? And this is what they said, okay? The combination of very simple process, tissue absorption, novel materials, and new analysis technologies make possible to expand the potential application of NIR-emitting nanoprobes. So the idea is that there is a lot of things that we can do by looking at the spectra of probes in the infrared within live animals. Thank you very much for your attention. Mm-hmm. No, not really. That's very expensive. The problem with this is hard to say, but the problem with the black animals is you can apply the same. The tissue distortion is going to be the same. The problem with the black animals is that you hit a lot them with the light because they absorb more. So then we need to reduce the radiation dose in black animals to keep the temperature of the animal lower. But all these things work also with that. But we have the extra problem of that you have to control the temperature of the animal. So you usually work with black animals because they are much cheaper. Yeah, you can see at the papers, and there is an avalanche of papers about that, using that, an avalanche of papers. And there is a video that I couldn't upload, but you have a look. The funny thing is that they published the paper in Science, and then many people tried to reproduce those results, and nobody was able to do that. So they were people complaining, and they just the authors were asked to do a nature protocol. And you go to the nature protocol and you follow the instructions, super easy. It's tricky, but it's super easy.
apply some techniques that are already applied, need to open a window, and this means that it's open space.
Look at the reference from this guy, Wasson Hon. I think that could be a Nobel Prize because he did a lot of things in brain, and he has some image in brain with this technology as well. Yeah, it's super interesting. That's a funny story that one of my students applied that and say, Danny, the tissues becomes transparent. And I go to the lab, he says, yes, the tissue is transparent and the lab is red, because this dye is super, everything that the student touched. So now the lab is still red, because those experiments. One day and the complete lab is red. Yeah. Always. They are very sensitive. I mean, the sensitivity is 4% per degree. So it means if you look at the intensity, there is a 4% of intensity decrease per 1 degree. So they are super sensitive. And the self-heating is always there, especially in the stem. Absolutely, you have to be very careful with that, and you must always play with the amount of light that you are putting into the animal, always. And then you need to take that background. This is the background temperature, and just close your eyes and say, okay, I think that is, but they are true. There are different methods we can do by spray, by covalent using covalents, and we just put in a rotovapor, and there are different techniques. We are working on different. The point here. The most important thing is the last polymer. I mean, I know chemistry. I knew a few chemistry, so I cannot say the name of the polymer, but the critical point is this polymer. I mean, it was tricky because at the beginning, at the end, Abbott never told us which is the first coating. This coating is produced by Abbott. And it's a coating that all the stents has to avoid inflammation in the artery. Okay, and also that coating has a drug that is released during the first 6 months. Okay, and they never told us what the coating. So at the beginning, the second coating, that is the coating containing luminescent nanoparticles, was not attached to this first polymer. So we were trying to do trials, and at the end, I don't remember exactly which one is, but they were able, I can give you the details, but they were able to do by using a rotovapor. All the processing is same, and they were able to do a second polymer, but it's covalent. The force is covalent, the union is covalent. Yeah. We don't know exactly where they are, but we think that they are between the two polymers.
have a question related with the silicon. So you have not detected the loss production?
Never. I mean, we didn't try. But
Okay, because
no, these are also these are also changing. When you put it in the cells, the fluorescence spectrum almost doesn't change, but the lifetime changes a lot. So what we are finding now, or we are realizing is that we need to reevaluate everything, because everything that a nanoparticle or a dye enters into a cell, it changes completely the behavior. So there's a big discussion about that. For instance, the people who use dyes for pH sensing inside the cells, be careful now. And they are starting to do the calibration inside their cell, because what the people say, that, okay, I'm calibrating my cuvette, and I put in the cell and I apply the same calibration for pH or for whatever in the cells. And we are now starting to realize that it's not like that. There is only one nanoparticle, only one, in which has been demonstrated that the response was the same in the cuvette or in water than in the cells, that are the nanoparticles that you develop. The only ones in the not in the lab, okay, in general. The only one that is giving a calibration in the water, giving the calibration in the cells, and they overlap perfectly, is only those nanoparticles. But they are protected by silica, and they are a nightmare to work with them, because they're emitting the visible, and they overlap with the autofluorescence of the cell. So it's a nightmare. It's complete a nightmare. But it was.
Next step.
Next step, yeah.
when do a combination for this generate also their mind. Because if you are able to localize the heat, and you can accumulate
Hit them.
light, maybe remove.
Yeah. Yeah, that's a super nice idea. We also have that idea, and we went super happy to the doctors and to the Abbott company, and said the Abbott company was very funny meeting. They told us, no, that could be interesting, because I mean, each stent that they give us is between 2,000 and 3,000 euros. So they want to say what they are putting them. They are not giving money. They are just giving the stents. Okay. No, but it's okay. But what we are interested really is in cooling down. So, come on. We lied. So they want us, because they want to remove the inflammation, and they want to cool down. They don't want to heat, because they don't want to release the lipids, because the problem of increasing the temperature, as far as I understood, is that you can break the plaque, and then all the las plaquettes, they come there, and you block the artery. So they, no, what I'm interested is in cooling down. Yeah, come on. You go one laser cooling inside the artery, like, yeah, that's why. Yeah, but I mean, that's impossible. We say yes to get more stents, but it's well, no, yeah, give us and we will try at least.
supplementation of line one photon from the nation and
Do you mean what is the limitation of 1 or 2?
linear and non-linear?
No. I mean, non-linear 2-photon imaging at in vivo is not working. I mean, 2-photon imaging is super nice for cells, but when you go to in vivo, high intensity, usually you need 980, that is hitting a lot of tissues. I mean, we work with 2-photon for in vitro for cells. For in vivo is the best thing for in vivo is is downshifting. I mean, you pump here 800 and you collect in the infrared. So 2-photon for us, the people is reporting a lot of nice papers, Science, Nature, in which they do 3D brain imaging with 2-photon spectroscopy, but it's only for 500 microns. If you want to go to millimeters or centimeters, that is our target. I want to, regarding the penetration, is that it's not going to be an issue in the future. Even with this approach or without. I saw by my eyes an experiment in Scotland, in Harry-Watt University, and they have a student with a laser diode here with a fiber, pulse laser diode, and a camera here with the t-shirt. Yeah? They illuminate with the laser diode that was milliwatts, tens of 100 milliwatts, and with the camera, they were able to see how the photons go out from the student. And by measuring the time that the photons takes from the back to the front, they were able to do a tomography. Because if you have air, like in the lungs, the photons are super fast. If you are in the heart, the photons are super slow. So they have the camera here. They have not published yet. I saw that like 1 year and a half, and I asked them to send me the videos, and we need to publish before. So they have the diode here and the camera here in the 800 nanometers. The diode, and the camera was super fast camera, and they were able to do a tomography of the student. So that problem is not going to be the limitation, because at the end you need 1 photon or 2 photons. No. This is the point that they have to. If you have the possibility, read that book. It's amazing. He was crazy, but that guy said you're right. And mine. 50 million people. So. Yeah. Be careful about that.
I have a curiosity about the second part on the training.
Yeah.
Because you said that you were to train the software with data, different depth, different depth. But while you're doing the training, how do you know is the
this is the true. You have always to. This is metrology. I mean, you have to assume which this is the ground truth of the training. This is something that you need to assume that this is your temperature, and this is the temperature of you have a system in which we can control the plate temperature, and we have a model in which we can simulate which is the diffusion of the temperature within the tissue, and we calculate an average temperature. But this is a ground truth. Always you need to say, okay, this is the thickness with the error and the temperature with the error. But it's, of course, the system and how good is the training depends on how good you are in setting the temperature and feeding the system what is the temperature. The good thing is that this, I mean, it's thousands. Like, the question is that our system is a animal imaging system that takes the image is 1000 by 1000 pixel, and then when you take an image, take a spectra per pixel. So with a single image, you have like 10 to the 4 spectra. You take several images, 10 images, 10 to the 5 spectra, 1 per pixel. Then you change the tissue, then you change the temperature and do the same. So it's just a question of days. There's a question of days. Yeah. Yeah.
According to you, what the best part of
For the implants, I mean, the implants, I mean, the stents is because we found Abbott, but now the idea, the idea is that this kind of technology for the implants, for the stents, I mean, let's say because the companies, the problem is that interacting with this company and the cardiologist is very hard because they know the diagnosis and moving to other things, and they are super worried about the nanoparticle. But what is the future is to put in that in the implants, in the knee, whatever, to remove infections, to track the infections, or just to see how strong or if the implant has moved or not. Okay, and the teeth. And then you can just have the fluorescent, and instead of X-ray, when you have to, let's suppose an implant. When you have an implant, how many X-ray images did you take from that? Every time that you go to the doctor, another X-ray. With this, if the implant has the nanoparticles, it's a diaphragm here, a camera from here, you can use a silicon camera as well. Super small, and then you can get it. And then this is the future, in my opinion. And the other future, that is, we just make a call to the hospital, Ramón y Cajal Hospital in Madrid, saying, okay, we have this technology, how many people is interested, okay? So we were expecting like 20 doctors coming to the meeting, only appeared 2. But one of them was how do you say otorrino? Otorrino for the heart, for a year. And they were interested in putting the nanoparticles here in the implants to see in the implant, but also to excite the implant. Because these nanoparticles are generating heat. Heat is vibration. Vibration is noise. So maybe to induce noise with a laser, infrared laser. Because they have this kind of implants that at the end are damaging the skin. So they were thinking, the idea was thinking, okay, let's use light to make the noise or transmit noise to your implant. And you can do remotely. So, I mean, the technology for the stents is because we want to publish this. It was a funny story that we submit to the journal. Said that's an excellent paper, blah, blah, blah. It will be nice if you can do the experiments in pigs and dogs. Let's move to another journal, you know. So it's like, but then the other things are much easier. For instance, to do these experiments in a pig, you need, to take all the cardio system to the farm, and this is super expensive. And the company is not giving us money for that. But I mean, for all implants, I think that we have a bright future. No. You mean the process of this? To get the spectra? No, doesn't work like that. No. I mean, the only thing that your question is, can you go in this direction? So, no? Yeah. No. No, we are not doing that. I mean, going in that direction is super complicated. So we are not trying. What we do is we just develop reference systems in which we can test that the material that this algorithm is working. So we just have 3D printers, and we just print a defect with nanoparticles in a controlled environment of tissue. So we know exactly the temperature and the thickness. And we just take the image and we just go send to the algorithms. And you can compare the output with the output provided to the printer. This is the only thing that we can do now. Going in the other direction, we have not tried, and it's complicated. In fact, there are multiple emission spectra that corresponds to the same T and D. So it's like sometimes it's bias stable, sometimes you have overfitting. So yeah. Yeah. I mean, so the first question is, there is no interaction between the nanoparticle and the molecules. The nanoparticles emit lights and the molecules absorb light, but there is no interaction. And then you collect the light that is not absorbed by the molecules. That's why you have the change on the emission. No, this is the main fact, that the lipids absorb the light. They are not interact with the nanoparticle. Nanoparticle, you can put also a lamp there if you want. If the stem is a lamp or a diode, you have then, you emit, and then you have the peak or the dip caused by the absorption of lipids. So there is no bio-interaction between the lipids and the nanoparticle. Not at all. No, there is an interaction between the photons emitted by the nanoparticles and the lipids. The nanoparticle is not touching the lipids. It's very close. It's like nanometers from the lipids, but there is not interacting. No, it is not. About the reproducibility, I mean, we have tests in different. I mean, the effect is always there. What is difficult is to try to get information about how many lipids you have from the depth or the change in the spectra. For the moment, we just want to localize and to tell the doctors which kind of lipids they have. In infrared jets. Or if it is not transparent, it has a flat transmission, so it doesn't affect your the data.
But when you have the two A B situation,
Yeah.
there is also different thickness of
The wall.
water layer.
Yeah.
So since the water also absorbs this region, how do you take it account?
No, we don't take it into account because the water is absorbing much less. So we assume that all the change is due to lipids. If you want to see the effect of water, you need millimeters. And this is, you have here, the lipids wall is around 0.1 millimeter. So we think that is just an approximation, yeah. Thank you.